Hello everyone, and thank you for joining us today. My name is Ed Arnold and I'm Vice President of Products here at LeveragePoint. I'd like to welcome all of you to our monthly webinar series of thought leadership in the area of value-based strategy. Sponsored by LeveragePoint. LeveragePoint provides the only software solution for value-based pricing. We offer a cloud-based collaboration platform that supports product innovation as well as sales enablement that changes the way companies create, communicate, and capture value. Find out more about us from our website, leveragepoint.com. Now, during the webinar, if you have any specific questions or comments, please feel free to enter them in the right-hand panel in the questions section. Later on, we'll respond to as many of them as we can. Now it's time to introduce today's speaker. We're very delighted to have Chris Provines with us today. Chris is a healthcare and medical technology expert with over 20 years of industry experience. He's had executive roles at Johnson & Johnson and Siemens Healthcare. Currently, he runs his own consultancy, Value Vantage Partners, where he shares his expertise and trains global clients in the areas of strategic pricing, value selling, and sales negotiation. He is also author of the book Strategic Pricing for Medical Technologies and teaches at the MBA program at Rutgers. It's great to have him with us today to cover a very timely and complex subject. So with that, Chris Provines, welcome.
Thank you, Ed. Welcome everyone. It's great to be with you, and thanks to the LeveragePoint team for having me. And good afternoon, good evening, and good morning, wherever you are in the world. It's really a pleasure to be with you and talk to you about healthcare in the U.S. and what's happening around the U.S. healthcare system and what that's causing for suppliers in the healthcare marketplace. So we're specifically going to talk about what do you now have to do to quantify and communicate and capture your value in this new age of healthcare reform. And then I'll share some best practices that leading companies are doing in the area of value-based management. So this is a fundamental shift that's happening in the marketplace. When you think of how products and solutions used to be purchased in the marketplace, particularly in healthcare, it used to be largely relationship-driven. I know for some products and solutions it's been evolving. But if you go to some of the more physician preference items, up until recent times, it has been really relationship-driven. And what's happening now, there are a variety of drivers causing changes in healthcare and how hospitals and other people purchase and select solutions. And they're really being driven to what I'll call value and data-driven buyers. And part of this is due to the maturity and the maturing nature of the hospital supply chain. Part of this is due to a lot of environmental factors that are quickly changing that I'll talk through in a minute. So this slide is a slide I like to use. It portrays many of the drivers that are accelerating this shift from more of a relationship purchasing to really data, value-based purchasing, and evidence-based purchasing. I won't read through all of these, but I'll highlight the ones that I think are pretty significant, and I'll start in the upper left-hand quadrant. So one of the key things that's happening, and it has happened in the U.S., is that there's been a fundamental shift in physician employment. There's statistics out there that in the next few years, the vast majority of physicians will be employed by hospitals, and that's really a fundamental shift. What that actually means is that they are now part of the hospital operation, they share part of the hospital P&L, they're part of the decision process, they're not independent anymore. That's changing the buying decisions and buying behavior of hospitals, but there's also a lot of other things happening. You have accountable care organizations, value-based purchasing, increasing evidence requirements. You now have lots of purchasing consultants in this space. So the sum total of all of these things means there's a lot of pressure on cost reductions, but also, for the first time ever, a lot of pressure on increasing quality and measuring and paying for quality in the U.S. healthcare system. And what that means for suppliers is there's lots of pressure on prices, on being able to understand and communicate your value, on utilization and margins. So if you go and ask hospital executives for their top concerns, you usually get a list like what you see here. And usually cost containment is normally one or number two on the list. Of course, improving patient quality is a top concern of them. Number three, reimbursement is usually one as well. And so what's important now to think about is how do you as a supplier connect your value proposition to what the customers are looking for. So clearly what the customers are looking for now from the supply base is A, help me reduce costs, B, help me improve quality. And so these are the direct concerns and focus of hospital executives. So all of this change is impacting a lot of different people in medical technology, pharmaceutical, and other suppliers in healthcare. But I think the group who is most impacted by this change that's happening is actually the sales team. And the sales team, the reason why I say this is they not only have to sell the features, benefits, and clinical outcomes of their technology, but now they have to move to being business people and really understanding a very complex healthcare market and thinking about how does their product impact one hospital who may be part of an accountable care organization, and comparing that to another hospital who's not a part of an accountable care organization who might be reimbursed very differently, and how do they take their message on value to those two different customers in a different way. So the sales team is one of the groups who is under the most pressure in this new wave of healthcare reform. So that's kind of a big picture framing of what's happening in the U.S. healthcare marketplace. Clearly the takeaway is there is increased focus on value, lots more cost pressure, your customers, hospitals, and providers being paid for quality, not just for doing procedures, doing more volume, but actually the quality and the outcomes related to that. And of course, they're going to be asking you as a supplier to be able to think about and communicate and connect your value proposition to their business model. So we're going to talk a bit about some strategies you can use and some case examples of suppliers who've done a nice job of quantifying and communicating their value. So of course, the first part of this is understanding your value proposition. What is it? And when I think about healthcare, the way I like to look at it is there's really three elements of value if you distill this down. There's clinical. So what are the clinical outcomes associated with your solution and how do you impact clinical outcomes? There's the economic value, which is the hard, quantifiable value that you can communicate to customers. And then, of course, there's psychological value. This is your relationship, the risk, some of the other things that are a bit harder to quantify, but they're there. Now, what makes healthcare so fun and interesting is it's not just communicating that to one group like a business-to-business or one entity. You have many different entities and stakeholders you have to communicate this value to, but also understand what is the value to these different groups. So these groups could be the patient, the provider, the physician, the insurer, and now we have this new organization called the Accountable Care Organization. This is essentially, for those of you new to healthcare, this is essentially a provider who's come together and they're at risk with Medicare to manage a population of Medicare patients over a 3-year period of time. And what's interesting about this is they not just are at risk for the event, so an acute event like someone comes in for a heart attack, but they're accountable for the cost of that patient inside and outside of the hospital. So this is a new mechanism put in place in the U.S. to help drive down costs, the total cost of care. So it's a bit different. It's almost like the provider is acting as an insurer, and many providers, many ACOs are coming up with their own insurance products. But what makes that interesting for a supplier is that you now have to understand what your product does inside the hospital, outside the hospital, over a long period of time. What is the value of that? So it's really a challenge for many suppliers. So understanding economic value, it's a big point. This is about really quantifying in dollar terms, if you're in the U.S., in dollar terms, what your product or solution does for the customer, different than the next best alternative. That's a pretty basic concept that's used in many industries. I think what makes healthcare very different is you not only have to ask that question, but there's some other key questions you need to ask related to that, and let's go through a couple of those. So in healthcare, of course, you have to ask the question of who ultimately pays. Is it Medicare? Is it Medicaid? Is it a commercial insurer? Is it an employer? Or is it patient pay? You also have to ask, how is the physician or provider paid? So what's the mechanism of payment for them? Are they paid based on a case rate? Are they paid based on a per diem, a fee for service? Or is there some kind of risk or bundled payment-based payment mechanism? Because all of these questions will help you lead to, how does the buyer evaluate the economics of my solution? So what are they looking at in terms of the value of their solution? It could be the total cost of ownership. So what is the cost to acquire, use, operate, maintain, and dispose of a solution over a period of time? That could be one measure. They may also look at that, but also how does your solution impact in a different way the incentives or reimbursement that they have in the system? How does it impact the cost of care for a patient over a period of time as opposed to one clinical event? And then maybe there's some risk mitigation in there that they evaluate your solution under. So unlike some business-to-business environments, what makes healthcare a bit different and unique is you have these other questions you need to ask and think about in terms of your product or solution. So let's move on to a couple of case examples. And I'm going to bring up a couple of them. These are what I call classic examples of value management. So the first one is the Cypher drug-eluting stent. This is a product that was launched by Johnson & Johnson about 10 or 12 years ago. It was the first drug-eluting stent ever launched. What makes this product interesting and different from a commercialization standpoint is at the time, bare metal stents, which was the next best alternative, were selling for about $1,000 in the U.S. So essentially, J&J tripled the price of this technology. And what made this an interesting case study is they were able to get away with this and capture the value of technology. And the way they were able to do this is they made a substantial investment in clinical and economic data, as well as did some outstanding reimbursement activities to unlock reimbursement right at launch. So it's an example and a nice case example of a blockbuster product where they went through and connected the process of quantifying value, of being able to communicate it through the clinical trials and a clinical study strategy, and then ultimately capturing that value through their pricing strategy. So it's a great example. The other example I like to use is the Oncotype DX test. So this is by a company named Genomic Health. This is in the diagnostics realm. So this is an innovative breast cancer recurrence assay. It helps predict a recurrence risk for breast cancer patients and helps direct chemotherapy. What's interesting about this product is, for those of you that have worked in the diagnostics industry, typically a diagnostic test that is a few $100s is considered outrageously expensive. And in this particular case, this product was launched at over $3,000. And what makes this really an interesting case is that they were able to get this price, and not only that, but it looked and appeared to be a fair value for money at that price. And the way they were able to do this is they invested in the clinical study, the evidence, and the value models to be able to take out to payers and others to explain not only the clinical value of the technology, but importantly here, translating that into the economic value for the person who's paying for it. So it's a great example in the diagnostic segment where tests typically are, in the dollars or less, where they took this product out in the thousands of dollars, and even then it's considered good value for money. So these are two classic examples of medical technology companies launching what are breakthrough products, real clinical innovation, but also thinking very strategically about the pricing and about value and connecting the process of quantifying value, being able to communicate that through a clinical trials strategy, and then ultimately capturing that value through pricing. So one of the things that often happens is, or I'm confronted with, is like people tell me, well, I don't have a blockbuster product to launch. I'm launching a product, or I have a product that went through a very different regulatory process. It might have went through a 510K or lab-developed test regulatory path. And therefore, I don't have any evidence, and since I have any evidence, I can't communicate the value. So that's kind of the chain of logic that often comes out. And so what do best practice companies do in this case? You don't need a blockbuster product with tons of clinical data to be able to come up with some kind of estimate of your value. So there's some very simple steps here. And the first I would say is prioritize your products or technologies. So start with those products that are really key for you, either in terms of the sales potential or in terms of things that give you leverage in accounts. So start with the products that really are going to make a difference for you. Pick one or two of those and move on to step two. Step two is very simply going through a process and trying to understand the value of that, trying to quantify the value in economic terms. And that could be through a single center study. It could be through some decision analytic modeling, which is basically taking some inputs into a tool and trying to predict what the value is. Or it could be through some some protocols that you develop with your regulatory folks to go out and study the customer economics. And then last step in this process, of course, is to develop that into a selling tool and deploy it through the sales organization. So these are steps that many best practice companies go through. They obviously, given the device and diagnostics industry in particular, has many, many products. So if you look into your sales bag, you might have hundreds of products. It probably doesn't make sense to go through and do this for all 100 products, but there probably are some really key technologies or solutions you have that you want to quantify and be able to go out and communicate your value. So you don't need to have a blockbuster product to start the process. So when we talk about value, there's an interesting point here. I think you have to step back and think about the value of your technology or a solution. And so what often people are focused on is the core product or the core solution, and thinking about the quality level, whether it's safety, efficacy, meeting a new unmet need. It could be speed or capability or capacity, depending on what you're talking about. But that's just part of the story. You have to also look at your enablers. And enablers could be things like automation, so taking something that's a manual process and automating them. It could be through using new mapping technologies that allow you to improve the deliverability of a device or speed up procedures. Or it could be through procedure kits and other technologies that help physicians do a procedure more efficiently than they're doing. It might not impact outcomes, but might impact efficiency. So those would be enablers. So you need to not only understand the core product or solution, but also the enablers. And then, of course, services. So what often happens is companies take these three things together and they're bundled into their offering today. And then when they come up against a buyer who is a price buyer or someone who's pushing them on price a lot, they have this bundled offering that's really hard to change. And the only thing they can pull, the only lever, is to lower their price. And then the other part of the offering strategy is the business terms. So the business terms are simply payment terms, contract length, performance requirements, any kind of risk sharing that takes place. So these are things that you think about value, you ought to be thinking about not just where am I different from a core technology perspective, but am I different in my services, am I different in my enablers, and then in business terms, do I have different business terms? So make sure you think about value very broadly. The other key point of this slide is as products reach the mature stage of the product lifecycle, often the value actually moves outside of the core solution into the enablers and the services and the business terms. And so part of thinking about your value proposition is, if you're in the mature stage of the product lifecycle, is it may not be in the core solution, but you could probably have some real differentiators that you want to value in the enablers and in the services. Okay, so let's move on and talk about what best practice companies are doing to grow in this area. So we're going to start with quantifying value, and here's a compilation of what I've seen best practice companies do. You probably, if you're in the industry, are doing some of these. You may be doing a number of these, but I rarely find companies that do all of these well. So the first one around quantifying value is to integrate your value into the R&D process. So best practice companies have formalized a process where they're looking and doing value analysis at different parts of the stage gate process. And they're actually quantifying the value. It's not some subjective measure or some conjoint study. It's actually quantifying in dollar terms what is the value of the technology and potential features and benefits under consideration. The other important point of dollarizing it as part of the R&D process is thinking about when and if I make investments in the clinical and economic evidence to prove value down the road. So having understanding of value will help you do that. The other thing best practice companies are doing around value is really trying to unbundle, as I talked about earlier, and pull apart the core product from the enablers and from the services and understand the value of those different components. And as they develop an understanding of value of these components, this leads into a couple of things. It lets them help shape their offerings so they can target different buyers with different offerings, helps them tier their service offerings and things like that. But also what best practice companies also do is then take this unbundled offering and turn this into trades, which I'll talk about in a little while, so that they can use these to trade during the negotiation process with the customer. So let's move on to communicating value. So there's two best practice areas here. First is to arm the sales team with value messages and tools. And this just doesn't mean just features and benefits. This means actually quantifying in dollar terms what the value means for that particular buyer. And the important point around this is aligning the messaging tool to the different buyer types and the different buyer mechanisms, payer mechanisms. So some buyers may be at risk and may be thinking about how do I manage the total cost of this patient over a long period of time. And so how they assess and think about the value of your solution will be different than others who may be only thinking about one clinical acute event in a hospital. And so the key thing here that best practice companies do is they have flexibility in their messaging to target different types of buyers with different payment mechanisms. And so the other key thing related to all this is they go out and educate their sales team on not only value, but the customer's business and business model. So one of the big obstacles I've found in deploying value selling tools and messaging to sales teams is often they lack a complete and full understanding of the customer's business model and the customer's financials. And what this leads to is the minute a economic buyer or financial officer in a hospital asks a question around finances, the selling process falls apart. So part of what best practice companies do is educate their sales team not only on value and how to use it, but importantly on the customer's business model. And then lastly, on capturing value, there's two key points here that best practice companies do. First is teach their sales team to negotiate with these new buyers. The hospital supply chain is maturing at a rapid pace. If you look at all of the studies out there, the hospital and the healthcare supply chain, in terms of its maturity, sophistication, has been way behind other industries. It's rapidly changing. And so one of the things that a lot of companies are faced with and are trying to deal with now is how do they prepare their sales team to sell and negotiate to these new buyers. And then lastly, related to this, is as the customer's payment model changes, as they go at risk through bundled payments, as they go at risk through ACOs and other payment mechanisms where the customer's taking on risk, they're starting to look to the suppliers to transfer some of that risk. So what smart companies are starting to do is think about population-based and risk-based contracting models to work with their customers. So that's a summary of the best practices. In conclusion, I know I went through some of this pretty quickly, but I've seen more change in healthcare. I've been in healthcare for 23 years. I've seen more change in the past year and a half to 2 years than there has been in about 20 years. I think that's going to continue at a rapid pace. healthcare suppliers who are prepared for this new normal will be at a significant advantage compared to those who aren't. And I think a key point of preparing for this is really getting clear on your value, being able to communicate it, and be able to align that with the customer, because this is where the future of healthcare is going, to value-based purchasing. So thanks, and Ed, I'll turn it back over to you.
Okay, well, thank you so much, Chris. That was excellent. That was excellent, and we do have time for a few questions, and I invite our audience to go ahead and add other questions that you have in the right-hand panel. One question I'll answer right off the bat, which is it possible to get a copy of the slide deck? Well, yes, we will make that available to you, as well as a recording of this webinar as well. So that will be coming out in a few days. So stay tuned for that. We'll email everybody who's attended today's webinar. But before we get into the questions, I do want to tell everyone that our next event will be at the upcoming Professional Pricing Society Conference in San Francisco on Friday, May 3rd at 1 p.m. I will be delivering a talk called Anyone Can Build a Value Model. Let me show you how. If you're planning to go to PPS, I hope you'll consider attending this session, and I promise to make it both interesting and fun. And for those of you who are not familiar with LeveragePoint, I'd like to take this brief opportunity to describe a little bit about how our customers use our cloud SaaS application to operationalize some of the value principles that Chris just spoke about, both on the product innovation as well as on the sales enablement sides of things. So first, what we see here is how you would quantify and visualize your customer economic value that you would use in StageGate. You see this here in our value modeling tool. And then in terms of communicating that value, we have a variety of formats that allow you to tell a compelling value story, and these can be customized for each individual customer and situation. And you can learn more about this from our website. So thank you for listening to that. You could also contact us directly. Our contact information is there. And of course, we have Chris Provine's contact information here. I know some of you may want to reach out to him, so we've provided that information as well. All right, so Chris, are you ready to answer some questions?
Absolutely.
All right, so one that just came in, if our biotech client with wound gel would normally engage the physician, who at the hospital will they begin to engage with to start to communicate their value? I hope I read that correctly.
Yeah, so this sounds like a specific product, but let me answer it broadly. So you want to think about in the hospital probably 3 or 4 different call points. So one would be the department head where the product is used. One might be someone in materials management. And the other is increasingly what's happening in hospitals is they're starting, because of the quality incentives that are built into the healthcare system, they're starting to think about people in their organization who are either formally designated or informally designated as kind of a quality person. So to the extent your product or solution can impact not only costs, but also some of the quality metrics. You know, unfortunately, due to the time of the presentation, we couldn't add a lot of the quality metrics, but most hospitals have a whole variety under the value-based purchasing program, quality metrics that they're accountable for, and this impacts their top-line reimbursement. And so there's a person assigned in the organization who helps monitor this and thinks about driving those quality metrics for the organization. So to the extent your product also impacts those quality metrics, you should be looking at that person as a call point as well. Okay?
Okay, next question. What are the top 1 or 2 things that manufacturers need to be aware of in terms of the new value-based purchasing rules?
Yeah, so they're very complicated. That's the first thing you should be aware of. But if you're a manufacturer and you're curious about it, you can go out on the CMS website and have a look. There's really 3 or 4 main areas that you should be aware of. The first is value-based purchasing. which is a whole host of incentives for hospitals and providers to get paid more for delivering better value, and those value are in a couple of areas. One is actually mortality benefits, which will be put into place, I think, beginning of this coming fiscal year. There are patient satisfaction measures, and there are other measures related to process. Each of these are tied to a reimbursement percentage that the hospital either gets dinged or rewarded for. Under ACOs, the hospitals are at risk for managing the cost of the patient over a period of time, both inpatient and outpatient, so you should become familiar with that. And then there's an area called readmission penalties where hospitals have an incentive to prevent patients from coming back within 30 days and being readmitted and incurring more costs. So if you're a manufacturer, you ought to be familiar with all of these areas and then start to map how your product or solution impacts each of these parts of healthcare reform. Next question, Ed.
Okay. How will physician employment trends and bundled payment programs impact customer buying behavior and pricing?
Yeah, so the physician piece is interesting. If you've been selling a physician preference item, which are things like stents and implants and other things, in the past, physicians were independently employed. They could go out and move their volume from one institution to another. Well, that's still the case. If you look at all the trends, physicians are increasingly being employed by the hospitals. So I've worked in purchasing or procurement for a period of time. I can tell you, trying to get people within your own organization who work for you is really a challenge to get them to change their spending habits. I couldn't imagine how hospitals used to work when they had to get someone who didn't work for them, try to get them to change their buying behavior. But all that is rapidly changing as physicians are becoming employed. So I talked to a friend who's a hospital CFO the other day, just to tell you a quick story. They just bought their physician practices. And I asked him, his name's Tony. Tony, how's that changed their behavior? And he said, in the past, they wouldn't even pay any attention when we asked them to have standardized on certain vendors and do things. But now that they're employed and they have a piece of the bottom line in the hospital, now they're asking questions like how do they get involved in the purchasing, how do they begin to standardize and things like that. So employment is going to play a big role in this. The bundle payment is another mechanism where the insurers and Medicare has gotten smart and they provide the hospital and physician one combined payment. And then it's up to them to split it. And so part of the behavior that this drives is, or that they're trying to drive, is a better alignment on driving outcomes and cost reductions between the hospital and the physician. So it should have a big impact on buying behavior over time.
Okay, another question. How soon before the hospitals will begin to buy direct and bypass the sales process?
Yeah, that's a very good question. There are startups out there in the procurement space who are trying to do just this for products where there's not a need for high clinical support from a salesperson, that they're trying to get hospitals to buy through an online exchange rather than have a salesperson involved in the selling process. Right now, they're targeting products that are what I'll call much, much more mature, that physicians are been using for a long period of time and that are very comfortable with using and don't need a lot of technical support. So I think the sales model generally is changing for the device and diagnostics and other manufacturers. In fact, there was a paper published not long ago that said it was called The Death of the MedTech Salesperson. Basically, the argument was because of all the changes, you're not going to need salespeople anymore. I happen to think it'll be just the opposite. I think that you'll need much, much more skilled salespeople because they'll have to stretch the realm of not only the clinical and anatomy and physiology and working with physicians and clinicians, but also they're going to have to connect the value of their product or solution to the customer's business model and changing reimbursement models. So I think it'll be just the opposite.
Okay. Let's see. Next question is, ACOs seem more like insurers. since they take on risk. How will this impact value communication and pricing?
So the ACOs are actually their providers who do take on risk, and some of the providers are actually who are ACOs are creating their own insurance products. So one of the things that's happening in the marketplace is a convergence of provider and insurer into this new entity. And so in the past, if you're a provider and you got paid for the inpatient event, someone came in and they had a hip or knee or something, or maybe a stent implanted or some kind of procedure. You got paid for that event. The person left the hospital, and if they had to come back in 60 days and have something else, you got paid again. And by the way, if they had to do a lot of imaging and other things outside of the hospital and you had those services, you got paid again. So it was really a volume-based system where the more you do, the more you get paid. And what ACOs are changing to is that's completely changing, and they're going to have a baseline that says for this population of patients, it costs you $100 to manage them. If you can get that down to $98 next year, we're going to share that $2 difference with you. And so, of course, they're going to be thinking about value in terms of what does it do to costs, but also do you reduce repeat procedures, readmissions, do you reduce costs somewhere else in the health system? So connecting your value proposition to that whole chain of clinical events and the costs are going to be very, very important.
Okay, questions are still coming in, and the next one is, since evidence will be a big driver of value, trials are costly, do we see emergence of other types of evidence being accepted to demonstrate value?
Yeah, I think that's a great question, and part of this goes to what is the product or solution and who's ultimately paying for it and what are you asking for in terms of a price premium. So obviously there's a connection between your value proposition, the price that you're trying to get or capture, and the amount of evidence you want to invest in to prove all of that. And so I think in the ACO model and other models, as they evolve, it'll be much easier than it has been in the past to do some kind of simple demonstration projects with either ACOs or large hospital systems to find ways to develop evidence that is not hugely costly like it has been in the past. What may also happen in the future, and it's happening in parts of healthcare, is maybe you won't be evidence development, but maybe you'll have some risk-based model with the ACO where you'll go at risk for some of the price that you're putting out there or some of the value that you want to capture. And because the ACO, by the very nature, will have to track outcomes and track costs, it'll be much easier to follow that patient over time and see what kind of costs and clinical events occur over time. So I think it should be easier in the future than it has been in the past.
Okay, one last question, and I think this is related just to the previous one. Buying decisions are increasingly being driven by committees. How do you use value with different non-clinical buyers?
Yeah, that's another great question, and before I answer that, I'll step back. There are actually two new societies in healthcare from a provider level. So there's a Society of Value Analysis Professionals, which is a new group out there. And there's another group out there, I don't remember their acronym, but they're part of American Hospital Association. And basically their mantra is cost, quality, and outcomes. So they're training people throughout the organization on cost, quality, and outcomes. And in their case, they're looking at having the supply chain function within hospitals lead this mantra and help take a value-based purchasing approach. But so there's a couple of issues with this. So there's committees in many hospitals. The percentage is fairly large that they have something called a value analysis committee or value analysis team. It may or may not be deployed in every service line within a hospital, but they're certainly in one or two at least. And it's typically comprised of people who are clinicians and non-clinicians, and they're trying to take value-based decisions on whatever solution they're trying to purchase. And so I think the good news is now there's a forum. If you do have a solution that you think is highly differentiated, has value, and you've been having trouble selling it, now you have a forum to go and explain your value to this cross-functional committee. But what that requires, as I talked about earlier, is if your sales team has been selling purely on clinical benefits, it's going to require a much more sophisticated salesperson who can range from the clinical side all the way to the economics and all the way to actually connecting it to reimbursement and value-based purchasing and some of these other incentives we've been talking about. So the good news is if you have a good value proposition, you've got a great start. Then you have to move on to preparing your sales team. The bad news is if you really don't have a handle on your value, going to these committees is going to be quite a difficult process. So that's really the first step in this.
All right. Well, Chris, thanks again for excellent presentation and some great responses to the questions we've been gathering. I appreciate you spending a little extra time. Thanks again, Chris.
It's been my pleasure, Ed. Thank you, everyone, for joining us, and thanks again to the Leverage Point team.
All right, and to our audience, that's all the time we have for today. Again, we will be providing a link to the slides and recording to our website shortly. Also, stay tuned for an announcement about our next webinar. So until next time, thank you for watching.